everybody knows Esther, but we have here Dr. Bushby is a 1972 graduate of the University of Illinois. He's CVM, a board certified veterinary surgeon. He has served on the Mississippi State University faculty for 43 years. He established the MSU CVM shelter program and is a frequent speaker on efficient spay neuter. He was a member of the organizing committee for the Shelter Medicine Specialty Board, received the ASPCA's Henry Berg Award in 2008, the AVMA's Animal Welfare Award in 2012, and the Association of Shelter Veterinarians Meritorious Service Award in 2015. He holds the Marcia Lane Endowed Chair of Humane Ethics and Animal Welfare at Mississippi State University. So I'd like to welcome Dr. Bushby and Esther Mechler, and we'll turn it over to them.
Okay, yesterday, Sherry Storms and Frank mentioned Peter Marsh and his inspiring work. Well, 5 Saves Lives was also drawn from his books. In fact, what we now call Feline Fix by 5 was first called 5 Saves Lives back in the 1990s. And the campaign was later called Beat the Heat. And now, for the past few years, Fix by 5. So today, what we're going to do is during our time, Dr. Bushby and I will start with a very brief history of Fix by 5. Then he will go into why fixing by 5 months is good for pets, parents, felines, and veterinarians. And then I'll come back very briefly at the end for a call to action. Okay, in some areas, spay neuter has been so successful that people are worrying about not enough pups and kittens to meet demand, in quotes, or even that there won't be any kittens anymore. And I'm here to tell you today that that's not going to happen. That's not the goal of the campaign, and it's not going to happen. The day when a kitten is not as easy to find, though, will be a good day for cats. The day when free to a good home kittens in a box in a parking lot or on Craigslist is a thing of the past will be a great day for cats. Kitten season, with its overwhelming burden, will be a thing of the past. This campaign can reduce the surplus and make things manageable. So here's what got us motivated. Back in 2011, PetSmart Charities commissioned a study by Ipsos Marketing. And there is confusion, they found, among owners as to the appropriate age to have dogs and cats spayed or neutered. 17% of them indicated they did not know. And almost as alarming are the 42% who indicated 6 months. And by that time, as we all know, cats can already have had a litter and be ready for the next one. And we're still an additional 14% say 9 months or old. This chart clearly indicated that 3/4 of these adults, and that was a sample of 3,000, either do not know or think that 6 months or later is fine. So here we have evidence that 3 out of 4 people, 3 out of 4 in the audience surveyed, had no idea, or else they thought it was 6 months or old. So why cats? In the 1990s, the number of shelter dogs began to go down, but large numbers of litters of unwanted kittens each spring and summer continued to be relinquished to shelters. So 10 years ago or so, Marion's Dream started a campaign to move the recommended age for spaying and neutering of cats back by 4 weeks, from the traditional 6 months, 5 months. Feline Fix by 5. Why 5? Why back just 4 weeks? Not 4 weeks or 3 weeks? Because we needed the support of the veterinarians. Most of them were recommending 6 months at that time. To ask them to move from 6 months back to 3 or 4 months would have taken a long time, and it would have created resistance. So we decided on 5, or I should say by 5, a range from 2 months to 5 months. And in 2016, January of 2016, with the help, considerable help of Joan Miller of the Fanciers Association, we formed a task force to look at the recommended age. In the summer, well, there was a meeting in Orlando at the North American Vet Conference, and all the people around the table agreed on 5 points. And that 5 points can be found on our Fix by 5 website, felinefixby5.org. They were, however, just individuals there, and they all had to go back to their organizations to get the organizational endorsement. That took another year and a half. By the summer of 2017, the American Veterinary Medical Association, the American Animal Hospital Association, the Association of Feline Practitioners, and the Catalyst Council had all approved the new guidelines. That is the good news. The bad news is that people do not know. What we've done is we have now gone to the various state associations, state VMAs, trying to get them to also endorse these guidelines. We figured that there are state meetings from time to time, and that's a better opportunity for us to meet with the veterinarians directly and get the message out on the State Veterinary Association homepages. So I guess part of our call to action is that people will address all these other states that still have not endorsed, the state vet associations have still not endorsed this policy. So part of our call to action is going to be to ask you out there, to ask your friends to use social media and get this message out. And now I'm going to turn it over to Dr. Bushby for the moment, and he's going to get into all the details about why Fix by 5. Dr. Bushby.
Yes, good morning. As Esther said right at the beginning, Fix by 5 is actually good for pets. It's good for the pet parents, and it's good for veterinarians. And what I hope to do in the next 10, 15 minutes is explain all the reasons why Fix by 5 is the natural and appropriate approach for sterilization of cats. If we can go to the next slide, please. All right. Let's start out with, why do we want to spay female cats prior to 5 months of age? Esther's already mentioned the issue of kitten season in shelters, when many shelters are just overrun with unplanned and unwanted litters of kittens. Obviously, female cats will come into heat. Generally by 5 months of age, can get pregnant, and then you're faced with, what do I do with this litter of 4 to 5 kittens that we didn't plan for and didn't want? So Esther's mentioned that one of the primary goals is to reduce the numbers of unwanted and unplanned litters of kittens. But what most people don't recognize is there's also very, very significant health benefits for sterilizing a female cat prior to its first heat cycle. Memory neoplasia is the 3rd most common tumor in cats. And the vast majority, over 90% of memory neoplasias in cats are malignant. And the average life expectancy of a female cat diagnosed with memory neoplasia, with or without treatment, is less than 1 year. So it's a common condition in cats, and it's basically a fatal condition in cats. Ovariohysterectomy prior to the first heat cycle, or prior to 5 months of age, reduces the incidence of memory neoplasia by over 90%. So we can start out literally by saying that spay neuter by 5 months of age, ovariohysterectomy or spay by 5 months of age, saves female cats' lives. All right. The second condition that's can occur in cats that are not spayed is pyometra. Pyometra is a massive uterine infection, which can also be fatal. Now, spay at any point in time prevents pyometra. So this one is not specific for reducing pyometra is not specific for spay prior to 5 months of age, but is essential that cats be spayed so they don't get pyometra later in life. And then obviously, again, Esther mentioned that female cats can get pregnant by 5 months of age. If we want to stop all of these unwanted, unplanned litters of kittens, then the appropriate age to spay or neuter a cat is prior to 5 months of age. Stop all of those unplanned kittens having kittens. All right, next slide, please. So why is castration or neutering good for male cats? Well, male cats can become, again, sexually mature by 5 months of age. And if you have male cats, you recognize that when they're sexually mature, they start marking their territory by spraying urine. They start roaming, looking for a mate. They fight other male cats over female cats. And so sterilization prior to sexual maturity, prior to 5 months of age, significantly reduces roaming and fighting, significantly reduces marking of territory, and sexual behaviors are one of the more common reasons that male cats are relinquished to shelters. So you have a better pet. It's not fighting, it's not roaming, and less risk of being relinquished to a shelter. Next slide, please. So why is it good for you and me, people who have and love cats? Well, first off, it eliminates the confusion of when should I sterilize my cat? It's interesting if you look, if you trace historically. In the intro, they mentioned that I graduated from veterinary school in 1972. In the late 60s and early 70s, they were actually advocating that in veterinary schools, they were actually teaching, let a female cat have at least 1 litter of kittens prior to sterilization, and wait until at least 9 months of age to neuter the male cats, to castrate the male cats. And there's a lot of that thinking still out there. Esther showed that slide of how people just don't know the appropriate age to spay or neuter. Well, where do people get their information from? Most of them get their information from veterinarians, and there's mixed messages sent by different veterinarians. Some saying wait till later, some saying do it earlier. With this campaign, we're trying to convince everyone that it is appropriate and it's beneficial to spay and neuter prior to 5 months of age, so we can eliminate that confusion of when do I have my cat sterilized. Obviously, we've already mentioned it reduces those unplanned, unwanted litters of kittens. All right, so you spay or neuter your cats, have your cat spayed or neutered prior to 5 months of age, you're not going to be dealing with that question of what do I do with this litter of kittens? Many years ago, HSUS produced a poster. It was a poster promoting spay neuter, but it had a basket full of extremely cute kittens. And the in bold print under the picture, it said, pick one, kiss the rest goodbye. And then in smaller print, it talked about the percentage of kittens that are relinquished to shelters that are euthanized in those shelters. Very impactful, poster to get the message across that if we continue to have unplanned, unwanted litters of kittens, then shelters are going to be overrun with kittens, and they end up having to euthanize some of them. Even those, if you think about it, even those people who say, well, yes, my cat had a litter of kittens, but I was able to find good homes for all of them. You know, that sounds very positive. But for every home that took one of these kittens, there's a kitten in a shelter that was euthanized because of it. There's only so many homes. As long as we're producing more kittens each year than we have homes for, then kittens are going to die in shelters. And then obviously, and we've mentioned this already when we talked about female and male cats, sterilization prior to 5 months of age reduces sexual behaviors that are very frequently causes for relinquishment of shelters in cats. The female cat that's coming in heat, the male cat that's spraying territory or roaming and fighting. Often those are reasons people relinquish their cats. So it's good for the female cats, it's good for the male cats, it's good for the pet parents, if you will. Next slide. So how is it good for the veterinarians? Well, a typical veterinarian in a small animal practice is going to have a standard kitten protocol. A client brings in a new kitten at 8 weeks, 10 weeks of age or whatever. There's a series of vaccinations and appointments for vaccination and parasite control that generally span from about 6 to 8 weeks all the way up to 14 to 16 weeks of age. And then there's this gap, right? So you finish the vaccination and parasite control series, then you go your very merry way, and sometime 2 to 3 months later, you're supposed to bring the cat back to be sterilized. But people delay or people forget or whatever. If you simply add one more appointment, most veterinarians have these vaccination parasite control appointments 2 to 3 weeks apart. So let's say your veterinarian is, the standard veterinarian is saying, we're going to start at 8 weeks of age, and at 8 weeks, 11 weeks, 14 weeks, we're going to do the vaccination series and parasite control. Just add one more appointment at the same interval of time. So 8 weeks, 11 weeks, 14 weeks, 17 weeks, bam. Now the animal's been fully vaccinated, has been treated for internal and external parasites, and has been sterilized. The surgeries are easier. It's interesting because if you've never done a ovariohysterectomy or a castration in a 4 to 5 month old kitten, there's a tendency to shy away from it, to be a little bit afraid of it. But the reality is the animals are smaller, there's much less fat, there's much less bleeding. The surgeries are faster, they're easier, recovery from anesthesia is faster. There was a survey, this is now 20 years ago, a survey conducted by a veterinarian by the name of Tracy Land, who is a high volume spay neuter surgeon, and she surveyed other high volume spay neuter surgeons back in the year 2000, 21 years ago. These veterinarians had collectively performed over 250,000 surgeries on pediatric kittens and pediatric puppies. And they were unanimous that the surgeries were easier, were faster, the recoveries are faster, right? So it improves compliance, the surgeries are easier, the patients recover faster, and you avoid having to deal with the issue of, okay, someone brings in their 6-month-old cat to be spayed, and in the physical exam, you palpate the abdomen and you feel kittens in the uterus. Now it eliminates the discussion of, do you want me to spay your cat while it's pregnant? The surgery is more difficult. The surgery is more dangerous. There's much blood supply to the uterus is much greater. Or do you want to have this litter of kittens that you're going to have to figure out what to do with? So it eliminates that potential, and it significantly reduces the chances for that veterinarian to have to deal with this cat 6, 8, 10 years later that now has metastatic mammary tumors or pyometras. Next slide, please. All right, so we've talked a little bit about this, but already, but it's important to emphasize these issues. Common arguments that we hear against spaying and neutering cats prior to 5 months of age is the surgeries are more difficult. Well, no, they are not more difficult. That's a misconception by people that were never trained to do a spay or a castration in a 5-month-old or younger cat. Right? But the amazing thing is, once they've done one, they realize this is so much easier. Right? Second misconception. Well, the anesthesia is just too dangerous. You can't anesthetize the cat that young. Again, I graduated from veterinary school in 1972, and that statement would have been absolutely true in 1972. Looking back at the anesthetic agents that were in use 50 years ago, they weren't safe for pediatric patients. But the anesthetic drugs we have now and the anesthetic protocols that we have now are perfectly safe in kittens as young as 6 weeks of age. In fact, there's been one study out there, and one study doesn't necessarily prove anything, but it does make an interesting point, where they looked at anesthetic and surgical complications in a population for ovarian hysterectomy in cats, and the first group of cats were under 12 weeks of age. Right? So one group of cats is less than 12 weeks of age, less than 3 months. Second group of cats is 3 to 5 months, and the third group of cats was 6 months or older. The group that had the fewest complications was under 12 weeks. The group that had the most complications was 6 months or older. So The surgeries are not more difficult, they're easier. Anesthesia is not too dangerous. It's perfectly safe in these cats. We hear it will increase if you castrate a male cat prior to sexual maturity. It will increase the chances of urinary obstruction. That is still a common explanation that we hear from veterinarians saying why they don't castrate cats younger. And yet there is nothing in the scientific literature that points to an increase in urinary obstruction in male cats castrated younger than 5 months of age. Nothing, not a single scientific study, not a single case report that connects urinary obstruction to the age of castration. The theory behind this myth is if you castrate the cat prior to sexual maturity, the penis is going to be smaller, the urethral diameter is going to be smaller. If the tube is smaller, there's a greater chance of the tube getting clogged. That's the theory. But urethral diameter has been measured in cats castrated at 7 weeks of age, 7 months of age, or left intact. Urethral diameters are the same. And when the cats reach adulthood, if they were castrated at 7 weeks of age or 7 months of age or not castrated at all, there's no change in the urethral diameter. So the basis for the theory that it would increase urinary obstruction in male cats is false. Right? Then the last one we hear is will predispose to orthopedic problems. There's been some articles in the veterinary literature dealing with large breed dogs that give the impression that spay neuter at an early age in large breed dogs may predispose to certain orthopedic conditions. The key here is cats are not dogs, and cats certainly are not large breed dogs. And again, there's no scientific evidence that spay or castration of cats at an early age predisposes to any orthopedic problems. So the resistance is out there, but it's all based upon either inexperience or misinformation. None of the common excuses, if you will, that people give to against spaying and neutering their cats at 5 months of age or younger, none of those excuses are valid. Next slide, please. And I think I've already said this. Kitten castration surgeries are extremely quick. Incisions are very small. You can use self-ties on the spermatic cord, and if this is being recorded, there's the link here. At some point in time, you may be able to click on this link and view a video of a full kitten castration and see how quick and simple it is. Next slide. And the same things with kitten spay, incisions extremely small, minimal fat, minimal hemorrhage, very fast recoveries. And again, a link that would show you to a video, would take you to a video of a, I think it was a 16-week-old kitten having an ovarian hysterectomy. Next slide, please. So implementation of this in a private practice is very simple, and we've talked about this a little bit already. It's add one more appointment to the basic kitten wellness program. That's what you do in a private practice. They have a basic wellness program, appointments every 2 to 3 weeks, add one more appointment. We've already mentioned that. But in a shelter, you're not necessarily going through that same sequence, and you want to spay or neuter the cat prior to adoption, regardless of the age of adoption. So, and it is safe and it is appropriate to spay and neuter as young as 6 to 8 weeks of age. Next slide. All right, Esther, it's back to you.
Back to me. Okay, what we put down here was a few bullet points for you. The first one is we're asking you, this is you who are listening now, anybody who's listening. The point was that the good news is that all this has been passed by the professional organizations at the highest level, but the bad news is that people don't know about it. And that includes the veterinary community, unfortunately. About half of them still haven't gotten the word. So we are going to call on you to speak with your veterinarian and bring him or her articles to understand why it's so important to fix by 5. And we have a website, which is listed here. You can go to that. And there are a lot of articles, journal articles for vets, articles for pet parents, all kinds of information about how this came to be and why we're asking fix by 5. What are the benefits to the cat, to the community? All of it is there. So please go there and download some of the articles and see if your veterinarian will ask his or her state veterinary medical association. That's not the veterinary board, it's the state vet association to fix by 5. To board endorsement at the state level is what we're looking for. And as you saw in the first part of this, only a dozen states have done this, even though the top level, the AVMA national, has endorsed, the state vet boards have not. That's our job now. Share articles from the Fix by 5 website on all social media and websites. The more we can get this out there, the better. There's videos, there's journal articles. Just go to the website and have a look. Speak with other friends, your colleagues. Those of you who are watching this today, no doubt, are already convinced, but just know that for every one of you that's convinced, there's many that aren't. So ask your friends to share on social media. That would be very helpful. And see if your shelter and state humane association will promote the campaign using brochures and posters. Again, we have a long way to go. We're doing a current survey of veterinarians across the country with a 250 vets surveyed, and over half of them are still thinking that male cats at least can be spayed at 6 months rather than 5. There's some movement back to 5 months for the females, but the males, they're still waiting until 6 months, and they're still recommending that. And as we know, so many of the calls, people wanting to relinquish cats, are they wanting to relinquish their male cat because he started. It's all about the hormones. That kicks in around 5 months or 4 months. So also a thing to remember, it's an age range from 2 months to 5 months. And that's what we're endorsing for the reasons Dr. Bushby explained. There's still pushback. It's up to us to work against that. So thank you all for listening, and we hope that you'll join us. The website is on the final slide here. Go there, have a look. There's many pages in there, and I'm sure you'll find what you want. And if you don't, contact us and let us know what you need. There's market materials there that you can print out and share. Thank you very much for your interest.
For Dr. Bushby, here's a question for you. What is your opinion on proceeding with a low-grade heart murmur on cats with their spay neuter?
Excuse me, a low-grade heart murmur in a cat that's not showing any clinical signs of heart disease, it is perfectly safe to anesthetize that cat and spay or neuter that cat.
We hear that if you fix cats too early, that they have a higher chance of urine leakage at a young age. Are there any studies on this?
Specifically in cats, no. In dogs, there is certainly an increase in estrogen responsive urinary incontinence in dogs that are spayed. It has nothing to do with the age at which the dog is spayed. There's a study out there, and I know I'm talking dogs in a cat conference here, but there's one study out there that says that spaying a dog earlier than 6 months of age increases the incidence of estrogen responsive urinary incontinence. There's one other study out there that says spaying them earlier than 6 months of age decreases the incidence. The bottom line is these are dog studies. There are no studies that show, and I'm not aware of any examples of urinary incontinence associated with ovarian hysterectomy in cats.
I think I've got, there's a couple of questions. Two questions here, one for Dr. Bushby. Is pediatric sterilization taught in most veterinary school programs now? And then this is for Esther or for you, Dr. Bushby. How are you measuring the impact of Feline Fixed by 5, the campaign?
All right, I'll take the first question and dump Esther with the second one. I'm afraid to use the word most. Pediatric spay neuter is certainly being taught now in many of the veterinary schools. The interesting thing is it is predominantly taught in those veterinary schools that have well-established shelter programs, and is not necessarily taught at all in those veterinary schools that don't have well-established shelter programs. But I don't have specific numbers. You know, there are 30 some odd veterinary schools in the country now, and I can't tell you, 20 of them are teaching early age spay neuter and 10 are not. I don't know the numbers. I know that the numbers are steadily increasing. The numbers of schools that are introducing students and teaching them how to do spay neuter of cats under 5 months of age is certainly increasing, but I don't know what that final number is at this point.
And go ahead, Esther, on the campaign.
Yeah, just as that is in flux, the numbers or percentages of veterinarians that have answered our survey is in flux. The first time we did a survey was maybe, would you say 2 years ago, Dr. Bushby? Something like two years ago.
Yeah, 2 to 3 years ago.
2 to 3 years ago, and it was a small sample, but about 25% of the veterinarians were saying that they recommended Fixed by 5. And now we've just completed one with 250 vets from around the country, and that number is coming closer to 50%. And I think that Peter Marsh did some calculations years ago that if we can get up to 75% or so of these veterinarians recommending Fixed by 5, that we will reach that balance where the number of kittens born pretty much equals the interest in homing, in good homes for these cats. So I think we're moving up, but we just like to move that needle a little quicker. We could wait 20 years and it'll probably happen, but we'd like to see it happen sooner. So that's why we're calling on your audience to help spread the word.
Last question, quickly, just are there any specific studies that that strongly demonstrate or document that there is a greater protective effect of a spay before 5 months versus 6 months, just that particular window, I believe is the question.
The protective effect on mammary neoplasia, yes, there are. For the other conditions I mentioned, pyometra, well, a spay at any age is going to prevent pyometra. But for mammary neoplasia, the most dramatic effect is if they're spayed prior to their first heat cycle, which usually occurs by 5 months of age in cats.
That's a clear demonstration. That is 90% reduction.
It reduces the incidence by 91%.
So that's a big factor, and I think we maybe need to promote that more. There are people who might be more interested in the fact that mammary gland cancer is greatly reduced. Maybe they're more interested in that than the the shelter issue, but we'll use whatever advantages that we can to promote this, because it has on many levels, it has advantages.
Excellent. Dr. Bushby and Esther, thank you so much for a great presentation. So we're going to